Hi, welcome to In Your Prime. I'm Jana Collier, publisher of the Dayton Daily News, the Springfield News Sun, and the Journal News. Thank you so much for joining us today for this important and interesting discussion of how we can prepare now to live our best lives as we grow older. We have four wonderful local experts joining us today. Kate Johnson of Medicare Resource Center is going to help us understand and make the best decisions around managing Medicare. Rafi Rodriguez of Rodriguez Financial Strategies will help us plan our finances for retirement. And Dr. Paul Haggerty and Dr. Rachel June, both of Kettering Health, will bring us practical and inspiring advice for staying physically and mentally healthy. The Southwest Ohio region is the perfect place to live at any age, but especially for us in the prime of our lives. This program will inspire and empower you to do just that. So let's get started. Well, it's fall, and along with the cooler temperatures and the colorful autumn leaves, it's also the season when a lot of us make very important health insurance decisions. Some of us are making those decisions for the first time, and they can have a lasting impact. But Kate Johnson is here to guide us. Kate is a licensed Medicare insurance agent and the vice president of Medicare Resource Center. She's active in her community and passionate about her mission, which is to empower people like you and me to make our best healthcare options. Hi, Kate. We're so happy to have you join us today on In Your Prime.
Hi, Jana. Good to see you.
Good to see you too. Well, let's set the stage. Describe for us what people are experiencing right now as they consider Medicare options, and help us understand what's different about the options this year.
Yeah, well, I'll tell you, they're experiencing a lot of advertising, that's for sure. I know my clients are talking about that frequently. And, the advertisements really make it sound like you can get a lot of benefits. But honestly, those extra benefits are only available for people in certain categories, maybe veterans or people who are lower in income and don't have additional assets. And so, the people who have those big advertising budgets and who are hiring celebrity spokespeople, they really don't have any plans available that we don't have at the local, in the local market as well. So if you would prefer not to work with a national company and you'd rather talk to someone face to face, we have about 60 agents in the area who are willing to meet with folks.
That's great. I know people really do want that local experience. So that is great to know.
And I'll tell you, the insurance companies get more and more creative every year with some additional benefits that are available. So one that they've come out with in the past few years is an over-the-counter catalog benefit. And so at no cost to the members, they're able to choose items that they use around their house, and those items are shipped directly to their homes. Maybe it's pain medication like aspirin or Tylenol. Perhaps it's vitamins, or you need an ankle brace or a blood pressure cuff, or all kinds of items. And so that's a great benefit. Another is that some of the plans are offering a flex card that can help pay for dental, vision, and hearing services. And golly, everybody needs that stuff. So that's a wonderful thing. You can go wherever you'd like to go and maybe have $500 this year toward glasses or dental work or toward hearing aids. So all of those things improve our quality of life and help us to be out of pain, don't they?
Absolutely.
Yeah. And there's gym memberships with the cards and so many great benefits in the different plans. So those are some of the new things that have come down the pike.
So what's the number one most common question you get asked about Medicare? And tell us the answer.
Well, I think what everybody is concerned about is penalties. There's a lot of talk about penalties for not filing your Medicare when you turn 65 or not having a drug plan. And it's good to meet with a licensed insurance agent and make sure that you have all of your T's crossed and your I's dotted when you turn 65. Even if you plan to delay your coverage, it's good to make sure that you understand all the ins and outs of the coverage, what you need to do now, what you need to do later. Also, I think sometimes people think, well, I'm going on Medicare, but I don't need a drug plan because I don't take any medications, any prescription medications. And I would just say that Medicare will fine you, will penalize you for every month where you don't have a drug plan. So it's really important to have a plan in place. The great thing is a lot of those can come in plans that don't have any additional cost other than what you're paying for your traditional Medicare.
Right. Now, I've heard of a Social Security program called Medicare Extra Help that helps people reduce what they pay for Medicare Part D prescription medications. I think a lot of people are confused about it and they don't realize that they may qualify. So help us understand the opportunities there and how we can take advantage of them.
Yeah, great question. Extra help is a Social Security benefit and one that's really available to anyone. It doesn't have anything to do with insurance coverage or anything like that. And what Social Security does, and we hear that 3 out of 4 people who qualify for it don't even know it exists. But we don't want, and Social Security doesn't want people choosing between paying their utility bill or paying for medications, or paying for groceries or paying for medications. And we hear that, and it's a sad situation. So if people are lower in income, and not as low as the people on Medicaid, but lower, and if they're lower in assets, and assets doesn't include your house and your car, the things that you need to get through daily life. But if you have a second house, they will consider that. They also consider bank accounts, your retirement accounts, things like that. But if you are limited in those resources and assets, then this program is available. When people qualify, it is said on average to be worth about $5,000 to the individual who's able to use the program. So it's a very, very valuable thing. And one of the great benefits of our situation is to be able to offer this and help people sign up for this and then see that we really improve their quality of life because they aren't paying so much for their prescription drugs.
Right. Wow, that's very helpful. Now, are there other programs like that, either within Social Security or Medicare, that people may not be aware of?
Absolutely, Jana. And one I would say that just started last year is an insulin savings program. And I don't know if you're aware, and I think many people who aren't diabetic aren't aware of the insulin costs. But they're very high, and it's very difficult for people on fixed incomes. And so Congress actually passed legislation for this insulin savings program that started last year. And with this program, your insulin never costs over $35. Now, it's a little bit complicated because only certain companies and only certain plans offer coverage, and they only offer coverage for certain insulins. And so it's kind of like putting a puzzle together to figure out the right plan that'll work for people. Other programs that people might consider, and really they're just considerations, and it's being a good advocate for your own health care. So the first is looking at your pharmacy, and is it preferred with the plan that you work with? You can be paying a lot more for your prescription drugs because they don't have a contractual relationship with the insurance company. So that's one factor. Another is, are my drugs name brand or are they generic? And I'm not a pharmacist. I'm not a doctor. I'm not telling you to change your prescription. Talk to your doctor about this. But if you're able to take generic medications, it really reduces your costs. And the statistic I read about that is 89% of the medications we take are generic, but they only account for 26% of the costs. Mm-hmm. So generic medications just are much more affordable for people. And again, anything that we can do to help you keep some of that fixed income is a good thing because you can use it for other things. The other thing that I'd mention would be just GoodRx. In GoodRx, I think a lot of people have heard of goodrx.com. It's a website and an app that you can put on your phone. But what it is a company who goes out and talks with pharmacies, and they have relationships with the pharmacies, negotiated rates for specific drugs. So maybe on your plan, you have a big deductible for your prescription drugs. And if you work through GoodRx, you might be able to get those medications at a lower rate. And so again, if we can save a few dollars here and there, it makes a big difference.
Absolutely. Well, thank you. That's really good information. Now, our audience is very engaged in this topic and they have a lot of questions. So let's take a couple of those questions now. What happens if you have to go into a nursing facility and don't have the private funds to pay for it? Does Medicare kick in to cover payment?
Boy, I wish that were true, but unfortunately, Medicare does not cover long-term care insurance. Now, there is there is coverage available if you need assisted living for a limited amount of time. Maybe you've had some surgery or you've had a medical setback and you just need a couple weeks to get on your feet before you go back to living independently. So for 20 days, Medicare covers the cost of your care in that sort of situation. And on some of the plans cover a percentage of the care for the next 80 days, as long as it's in that sort of situation where you've had a setback or something like that. But beyond 100 days, there really isn't coverage through Medicare. And so if you're looking at a long-term care situation, my best advice is to talk to an elder care attorney. And those attorneys can advise you on what to do to be set up if you're not able to afford that care, because there are systems in place to catch us, safety nets for situations like that. The other thing that you can do while you're talking with an elder care attorney is set up an authorized representative or a power of attorney situation, because what happens if you become incapacitated and aren't able to make your own healthcare decisions? So that's a good time to just do some planning for the future, what could come down the pike.
Right. Well, here's another reader question. Does Medicare allow home visits and telehealth visits?
Boy, we've all become more familiar with telehealth visits in the last couple of years, haven't we? It's not quite the same as being in the doctor's office, but it's kind of awesome to be in your jammies and be able to talk to a doctor too. So that works out. I would say that yes, telehealth is definitely covered. Home visits are it depends on the plan. Some of the plans help cover the costs of those. And sometimes home health care is a factor. So maybe you have had a surgery and you're able to go home, but you need a little help to make sure that all of your medical needs are getting met and making sure that your blood pressure is staying where it ought to and all of those things. And so many of the plans do offer home health care as an option if your doctor recommends that.
Good, thank you. Now, I know from your excellent website that you offer a wide variety of educational opportunities for people. Tell us how people can learn more about Medicare and how they can begin to make the best decisions for themselves.
Well, thank you, Jana. You know, our website is resourcemedicare.com, or you can look up Resource Dayton. Either one will take you to our website. And we have what are called Medicare Academies, and those are educational events. Some are on Zoom, some are live, and they're at various times in various topics, because you might want to learn more about saving money with your prescription drugs, which we were talking about a little bit earlier, or you might want to learn how to make the most of your Medicare from year to year. And so, or Medicare may be brand new to you and you need to learn about what Medicare A, B, C, and D actually are and how to get started in the system. So there are different classes available. So you can register for those on our website. We also offer strategy sessions with agents, and you can sign up for those on our website as well.
Great, thank you. Well, what have we not covered today that you think folks really need to know about Medicare?
You know, the thing that I get asked a lot about is travel. I think a lot of us, as we get to Medicare age and we think about retiring, we want to be gone a little bit out of Ohio. We don't want to be here all the time. And so people are concerned whether they'll have healthcare coverage when they're traveling. And the good news is that no matter what plan you have, they all have coverage for emergency care and urgent care. So if you need to go if something happens while you're gone and you need to go for urgent care because golly, you got pink eye and I need some eye drops to heal it up, then you can go do that. And likewise, emergency. I mean, you fall and break an ankle, you got to get care now. And so all of the insurance companies are aware of that. There's coverage with any of the plans. But sometimes people are snowbirds. Maybe they want to go to Florida or another place and they want to be there for several months. And they want to have an established relationship. Maybe they need to get lab work done when they're gone. Maybe they need to see a cardiologist because they're going to be there for several months. In those circumstances, it's important to make sure you're in a plan that either has a national network or a plan that doesn't work with networks, that works outside of networks. And we can help you, again, put that jigsaw puzzle together and figure out the right plan that will work for travel. Now, international travel is kind of its own bird. And so if you are going to travel internationally, we really recommend that you get the travel insurance. It's just part of the cost of the trip. But I would just hate for anyone to be far away and something catastrophic to happen and not be able to get home or come home and have a whole lot of costs that they're dealing with. So we do recommend that you make sure that you have all your bases covered when you travel.
Great. Well, thank you so much, Kate, for joining us today. This has just been amazingly helpful information, and I so appreciate you coming on In Your Prime today. Thank you.
Thanks, Jana. Good to see you.
Good to see you too. This program is sponsored in part by Kettering Health.
Kettering Health's Years Ahead Health Center focuses on the needs of seniors, offering health services and programs designed specifically for you so you can be your best. Call 937-281-6340 to schedule your appointment today.
Our sponsors make this program and In Your Prime possible. Thank you to Kettering Health, Medicare Resource Center, and Rodriguez Financial Services, LLC. Today we're talking with Dr. Paul Haggerty about men's health. Dr. Haggerty served on active duty in the Air Force and continues to serve our country as a member of the Ohio Air National Guard. He works to create a strong relationship with patients so they feel comfortable talking about their health challenges. Welcome, Dr. Haggerty.
Thank you for having me on, Jana.
It's so good to have you on this edition of In Your Prime to talk about men and aging. To start, tell us a little bit about your approach to helping patients.
Sure. I like to foster a patient-centered approach when I meet with my patients. Talking about men's health covers a lot of important topics, and I feel it's really important for me to establish a good relationship with my patients so that they trust me and will follow some of the recommendations that I have for them. I like to see myself as a medical advisor for them. My role is to educate them so that they have a good understanding of their health and any issues that may come up, so that ultimately they can make decisions that they feel are in their best interests for their long-term health, and also to help guide them through questions that they have. As we get older, it's not uncommon for folks to get some health problems that come along. And so sometimes those can be difficult or challenging issues. And my job is to help them through those transitions as they get older in life. Great,
thank you. Well, what are some common urologic issues that men experience as they get older?
Sure. There's several conditions that men get quite commonly as they get older. Probably one of the most common is something called BPH, which stands for benign prostatic hypertrophy, which is basically a benign growth of the prostate that can cause men to have some urinary issues. And those urinary issues might include having to urinate more frequently or more urgently at times, or they may have trouble starting or stopping their stream of urine. Some men will experience urinary retention at times, or not being able to empty their bladder fully. And some of these symptoms will often manifest themselves in having to urinate frequently at nighttime. So BPH is very common. Another disorder that we see commonly in men is erectile dysfunction. As men get older, their testosterone levels go down. And there are some other health conditions, such as high blood pressure and heart disease and diabetes, which are commonly linked with erectile dysfunction. So we see that quite commonly. And then finally, another issue that is probably on the minds of many men is prostate cancer. I'm sure many of our patients have had a loved one or a friend who has been affected by prostate cancer. That is actually the most common cancer that men will get, aside from skin cancers in America. So that's something that I frequently talk with my male patients about.
Great, thank you. Now, sometimes it's hard for us to know what's just a normal part of the aging process and what's really a sign of something serious. So, what kinds of symptoms should men be concerned about?
Yeah, I think this is a very good question. So some of the disorders I mentioned before, so the BPH, or benign prostatic hypertrophy, that can present with symptoms that are similar to prostate cancer. And so it can be difficult to tease out the difference between the two of them just based on symptoms alone. So if men are experiencing any new urinary issues, I think it's always a good idea for them to go in to see their doctor and get an exam, talk with their doctor about the symptoms that they're having, so that it may be something where it's just a benign growth of the prostate, and there's medications that we can use to treat patients with that. Or if they may have prostate cancer, then we can hopefully catch it at an early stage where it's more treatable.
A lot of men may actually shy away from seeking help for their issues. How can family members encourage and support men as they seek health care?
Sure. I think urologic issues for men are a very sensitive topic. Many men naturally can be embarrassed to talk about some of these issues. In our culture, we always think of men as being strong, and sometimes men don't want to seek help. But I guess I would tell my patients that these issues are very, very common, and it's very likely that someone that they know, whether it's issues with difficulty urinating or erectile dysfunction or prostate cancer, very common that they will know someone that has those disorders. So I encourage men to come in and get checked out early, as opposed to waiting or putting things off until things get worse. Oftentimes, if we can catch things early or treat things early in the disease process, then men tend to do better overall.
Yes, thank you. Well, our audience, both men and women, are very interested in this topic. So let's take a couple of questions from the audience.
Sure.
So the first question is, should men be screened for prostate cancer?
That's a very good question. So I will say the guidelines or the recommendations on prostate cancer screening have really changed a lot over the years. When I first started practicing as a physician, every man that walked through the door would typically get a rectal exam and a blood test called a PSA to screen for prostate cancer. And now things are a little bit more nuanced, and we have a little bit more of an individualized approach to screening for prostate cancer. And some of this has to do with some of the advancements that have come along in the way that we manage prostate cancer. So the way that I approach prostate cancer screening for men is to have a discussion about some of the risks and benefits of screening for prostate cancer. The benefits obviously are, if we can catch a cancer at an early stage, men tend to do better. And you may wonder, well, what risks could there be from screening for prostate cancer? I would say in the past, men sometimes were treated for prostate cancer that perhaps was a slow growing variety, maybe a less aggressive form of prostate cancer. And that would typically include either having their prostate taken out or radiation therapy to the prostate. And sometimes there are some side effects from those treatments that might include erectile dysfunction or urinary incontinence. And so perhaps in the distant past, some men were maybe getting treated for a lower grade cancer that probably wouldn't have taken their life down the road, and maybe that treatment wasn't necessary. And so now what we'll offer men is if they have an elevation in their PSA, which is a prostate specific antigen, which is a blood test to screen for prostate cancer, typically they'll get referred to a urologist who will talk with them about doing a biopsy of the prostate. And if the biopsy results come back showing what's called a low-grade prostate cancer, then oftentimes they'll get offered something that's called active surveillance, which is a way where men get monitored very closely for their PSA. And sometimes there's some imaging tests that they'll do to monitor that. And that's actually been shown to help men do very well in the long term in terms of making sure that they're not dying from that prostate cancer, because that's the main thing. Is we want to try to prevent death or serious disease from something like prostate cancer. So if a man has a slow growing form of prostate cancer that they might not need treated and they can just be closely monitored, and we can spare them from some procedures, then that's a win. On the flip side of the coin is if we screen men early and we find that they may have an aggressive form of prostate cancer that could take their life, if we can intervene early and treat that prostate cancer, then they have much better survival rates. So kind of getting back to what we talked about early, I think it's good to have these conversations with men. Go in, see your doctor, have a good conversation about screening for prostate cancer. I think that is a very important topic for men just because of how common a cancer that is in America.
That's very, very helpful. Thank you. So here's another question from the audience. My father resists seeing the doctor, even though it seems like he should be going more often. What can grown children do when their parents need more help than they are seeking?
Yeah, that's certainly a challenging issue, and I see that a lot. I have a lot of children that come in with their older parents, and I think that's good. It's always good to have family support. But what I would encourage folks is preventive medicine. I'm a big believer in preventive medicine. You know, there's an expression, an ounce of prevention is worth a pound of cure. So don't wait. Don't put things off until the dam is about to break. It's always good to come in and get things checked out. And even if you're not having any problems, it's always good to establish care with a physician so that if there is something that pops up down the road, they've already met you, you guys have already established some rapport, and so that they can help you with whatever issues arise.
Good, thank you. Well, what else should men consider as they think about staying healthy?
Yeah, there's a couple other topics that I think are important. Cardiovascular disease is, one of the biggest healthcare issues that we see in our country. So, things like making sure your blood pressure is under good control, making sure your cholesterol is well controlled, screening for diabetes, or if you have diabetes, then making sure your blood sugar is under good control. These are all what we call modifiable risk factors that if we can take care of them early, then we can be very successful in preventing future harm down the road. And really the big thing we want to prevent is heart attacks and strokes and complications that come from those, because a heart attack or a stroke can be life-altering, if not fatal. And so a lot of these things like high blood pressure, we call that the silent killer because many times we don't have symptoms until an emergency arises. These are diseases that do damage to our bodies slowly over time. So it's good to come in and get checked out early and regularly. And if you do have high blood pressure or high cholesterol and diabetes, it's good to see your physician regularly so that those things can be kept in check. And we have a lot of very good medicines that have been well studied to help patients live longer, healthier lives if they are diagnosed with those diseases.
Great. Well, is there anything else that we haven't covered that you want to be sure the men in our community are aware of?
Yeah, thank you for asking. I think two more topics while we're on preventive medicine. Colon cancer screening is very important. So traditionally, we would start to offer colon cancer screening at age 50, and now 45 is the new 50. So for men who are 45 or older, it's now encouraged to start thinking about getting screened for colon cancer. They're traditionally done with a colonoscopy, but there are several other ways to do that. There's another diagnosis or diagnostic tool called a flexible sigmoidoscopy, and then there's some stool tests that can be done to screen for colon cancer as well. So that's really important for all men 45 and older, and especially if you have a family history of colon cancer, I would definitely talk with your physician about getting screened. And then the last thing that I'll touch on is very, prevalent in the news in our community is getting vaccinated against COVID-19. So we have several vaccinations that are available that are very effective and generally safe in preventing serious disease or death from COVID-19. So I think we all have felt the impact of COVID-19 in one way or another, whether it's from someone that we know or personally or economically. And really the best tools that we have to prevent the spread of COVID-19 are vaccinations and masking up. So we're still encouraging folks to practice social distancing when they're in large crowds and things like that. So can't emphasize the importance of that enough.
That's great. Well, thank you so much for joining us today on In Your Prime. Your insights and advice have really been so valuable and helpful for our audience today. Thank you so much.
Thank you, Jana. It's been a pleasure.
Our next guest is Rafi Rodriguez, the president of Rodriguez Financial Strategies, LLC. Rafi began his career as a financial advisor in 2004 after completing his successful military service. That experience in the military not only shaped Rafi's life, it also gave him the unique ability to understand the special needs of military retirees and business owners. Welcome, Rafi. We're so glad to have you today on In Your Prime.
Welcome, Jana. It's good to be here. Thank you.
So, what are the biggest concerns you see today as people plan for retirement, and how is that changing?
Well, one of the things about retirement planning is that sometimes people just wait until retirement to start planning. When you start looking at retirement planning, it's always a good idea to start about maybe 5, in some cases 10 years out. Not only where would you like to live, what is the lifestyle that you like to have, also what liabilities should be paid off so you don't continue to carry that into retirement. And for example, it's always a good idea to have an inventory about your emergency savings, about your liabilities, about your risk management, like the insurance policies that you have, as well as your investments. Having an inventory, it sets a stage of where you are right now, and also it will help the financial advisor guide you where you want to be. And also don't forget your estate planning documents. It's always good to think ahead before you retire. And even during the retirement, it's a good idea to take a look at those.
That's great. Thank you. Well, what are the most important things that someone should consider as they contemplate retirement?
Well, it is important, Janet, to review the retirement plan at least once a year, predominantly because there's typically 3 stages in retirement. One is the go-go years. We're very active. We're moving around. We're traveling, visiting with family and friends. In many cases, even having another career, another job. But then there's another stage called the slow-go years, where due to the body start talking to us, we may want to slow down, and then we just not as active. That's a unique stage. And then there's this no-go years where we actually bedridden or suffering from an illness that does not allow us to be so mobile. So it is important to be aware of these stages, review your plan every year, and also, when appropriate, include your children and family members in those planning decisions. In many cases, they may have to come in and help you out.
Right. Well, is it best to take Social Security benefits at 62 or to wait until the full retirement age or wait until age 70?
Well, Jana, that's a really good question. As we know, Social Security is the main income for many, many Americans. And in order to decide when is the best time to take Social Security and apply for it, it really depends on many factors. For example, are you still working? And if you're still working beyond, like from 62 to your full retirement age, there may be a taxability on your Social Security benefits. Also, if you have an illness that is critical, in some cases, it may be advisable to take Social Security early. Also, if you have other investments that you could depend on for retirement, you may want to maybe tap into those first and let Social Security grow, typically 8% a year until age 70. So there's many factors in how to consider Social Security as part of an integral part of your retirement income.
Right. Now, should people reach out to a financial planner?
Well, absolutely. I mean, these are some tough decisions, and sometimes there may be some aspects of your retirement lifestyle that you may not have addressed. And it is important to clarify your doubts with a professional that is familiar with these issues. Remember, financial planners, they specialize in different fields, and retirement income planning is one that I decided to specialize because there's such a need in helping people making the right decisions in their retirement.
So what kind of challenges do people face when they're choosing a financial advisor?
One of the things is it's when there's a crisis. A lot of people look for a financial advisor when there's a financial crisis, when in fact, it's always good to plan ahead and maybe adapt to challenges in life, because life will always happen, instead of having a knee-jerk reaction. And it's also important for people to look at a financial advisor, financial planner, who is thoroughly familiar with the industry or the benefits that you are trying to integrate into your retirement life. I'll give you one case. I am a retired military officer, and I'm very familiar with the federal government benefits. So that's my niche. I know that industry quite well. So don't wait until there's a crisis. Work with a financial planner way before that.
Now, what's the best way to prepare for a meeting with that financial advisor?
Well, first of all, it's always a good idea to check out the financial advisor. If they have a website, check them out, do your own due diligence. There's a website called I think it's called brokercheck.finra.org, and that is to see if that advisor has any back marks on his or her record. Most important, find out if that financial advisor is a true fiduciary. In other words, is the advice going to be based on what's more important to the client, or is it a benefit to the financial advisor, mostly economically? So look for fiduciary advisors. And also, it's really, really good to have your own ducks lined up. What I mean by that is, check out your inventory, like I mentioned earlier. Where are your savings, your investments, your life insurance, your liabilities, and your estate planning documents, so that those questions can be addressed with the documents in hand. So be ready when you look for a financial advisor.
Now, retirement planning is definitely on our audience's minds. So let's take a couple of questions from the audience.
Okay.
Folks are curious about Social Security. I know you don't have a crystal ball, but we would like to hear your thoughts about how long Social Security will last.
According to the 2021 annual report by the Social Security Board of Trustees, if nothing changes, the trust fund could potentially be depleted by 2034. And it worries a lot of people, including myself. I'm a recipient of Social Security benefits already. So If nothing changes again, we may end up seeing a reduction in benefits, potentially 78% or so of what we currently scheduled to receive. So there's some challenges to Social Security that we all need to be aware. Baby boomers are retiring at large numbers on a yearly basis. So they're actually tapping into Social Security quite often. Behind us, behind baby boomers, there's not a lot of young folks contributing to Social Security for many reasons. There's not that many of them. And also due to the pandemic, there's been people have been laid off and they stopped paying into Social Security. So there's a lot of challenges out there that we need to be fully aware. So a couple of things can happen to make Social Security better. One of it is maybe reduce the benefits to the future, raise taxes, so that more people pay into Social Security, or a combination thereof. There are many other things that people are looking at. But I think Social Security will be around, but it's time for Congress to, and they are looking at it very seriously, because by 2034, it's only around the corner, and we don't want that trust fund to be depleted.
Right. Now, another of our readers wants to know about seniors who want to keep working but don't have up-to-date job skills. Are there programs out there for them to get those job skills?
Of course, there's plenty of opportunities for seniors. And the first thing I advise my clients or have that question is, first of all, pursue your the things that you're passionate about first. Maybe you had a hobby while you were working. Now you want to pursue that hobby and maybe turn it into an income generating activity. Pursue those first. But most important, depending on your specific career, you need to find out from the trade association for that career, for example, what are the credentials that you need going forward in your retirement. Now, retirement doesn't mean, remember I mentioned the go-go years, you still want to be active in the community. So check out with the local library. There's all kinds of resources out there. I mentioned the trade associations, the employer that you're looking to work with. If you're going to be an employer or self-employed, check out what are the credentials required. And just as important, check out AARP. They have some great suggestions on careers for seniors and things that should be fun. That's a stage in life where you should be enjoying your life to the fullest. So plenty of resources, including your library, and go charge ahead and continue to stay busy and enjoy your retirement.
Absolutely. Well, thank you so much for sharing your advice with us. Now, before we move on, is there anything else our viewers should consider as they contemplate retirement? Well,
the most important thing is, if you don't have a financial advisor that is a specialist on retirement income, it's time to really consider working with a certified professional that knows the ins and outs of retirement planning, and also who's an expert on the benefits from the industry that you came from, and as somebody that's also a fiduciary. Those are the top three things that you should be looking for before jumping into that interesting journey we call retirement.
Well, thank you, Rafi, so much for sharing your insights today about saving and planning for retirement. It was so good to talk to you.
Always a pleasure, Jana. Thank you.
Thank you. Let's turn our attention to our physical health. Dr. Rachel June with Kettering Health is joining us today to talk about the importance of annual wellness visits. Dr. June practices geriatric medicine and provides primary care at Kettering Health. She specializes in care for dementia and planning for advanced care and chronic disease management. She's a compassionate physician dedicated to helping older adults. Welcome, Dr. June.
Thank you so much for having me back.
We're so glad to have you again. So what is an annual wellness visit? How is it different from an annual physical exam, and why is it important?
So an annual wellness visit is a Medicare benefit. So you would not have one of these until you become Medicare eligible, typically at 65 years old. And an annual wellness exam is a bit different than a physical exam because we're not focusing so much on laying hands on and doing an exam. It's more talking through someone's function and their history. And so these visits are really important because it's our chance once a year to look at all of these concerns and prevention, whereas most of our visits throughout the year tend to focus on if someone's having a problem or treating a medical condition. This is our time to be preventative and really focus on what we can do to keep people healthy.
So, what should a patient expect from the experience of a wellness exam?
Yeah, so an annual wellness exam is going to be different than an annual physical exam. First off, it's different before the exam. There's actually some homework usually before a patient comes in. So you'll either be provided with a packet when you leave your last exam and schedule this, or when you come in. And this packet's called a health risk assessment. So it's asking the patient to tell their provider, how do they think their health is? How are things going for them? And then it kind of breaks things down by different categories about different functioning, how someone's doing and getting around their home, managing their medications or their meals, asking questions about if they're noticing changes in their memory or their hearing, and also seeing what resources do they have in the community. Are they seeing some other health providers that their primary care doctor may not know about, or getting health supplies from someplace? So it lets us really get a good, thorough history and see what could be lacking or where we could improve someone's health and support.
Great. Now, should a patient still get a physical exam or address other kinds of concerns at their annual wellness visit?
That's a great question, and it's going to vary depending on a patient's insurance as well. Medicare itself will only pay for the annual wellness, and then it's a full benefit to the patient. So they would have no out-of-pocket expense for an annual wellness exam. Some of the Medicare managed plans do allow for an annual physical. And I personally know that many of my patients want that annual physical, want everything to be checked out. And so if they're one of those patients, I'm more than happy to do both at that same visit. And the same being said, if they come in and there's another problem, I'm here to address my annual visit, but my diabetes has been less controlled, or I need this adjusted too. Certainly that can be done in the same visit. There just may be a copay during those complaints.
Gotcha. Now, family members really want to be supportive, but they just don't always know what to do. How can family members help their loved one during an annual wellness visit?
So they could certainly be helpful in completing these health risk assessments, whether that be prior to coming into the appointment or with the patient at that visit. And then just chiming in as the patient is comfortable if they feel like mom or dad maybe answered that they're not struggling with something, but the loved one's seeing a concern that they maybe haven't noticed. And that tends to be seen more with some cognitive concerns, that maybe a family member is noticing some memory concerns that a patient may not recognize themselves. And that lets us know that we need to do further screening at this annual visit to do some cognitive testing and see what's going on there. It's also helpful if families can make sure lists of medications and those providers are all up to date, just so that we're all staying on the same page and open communication.
Now, staying healthy longer is vitally important to our audience. So let's go to some of their questions. So here's a question from the audience. Is dementia the same thing as Alzheimer's?
That's a really great question, and one that people tend to use those terms interchangeably, and it's really not the same. Dementia is the big umbrella term for any neurocognitive impairment that causes functional decline. And the most common type of dementia is Alzheimer's. And so that's why often those two are equated to be the same. But there are several different types of dementias that are less common than Alzheimer's. Things like vascular dementia being caused by strokes, or Lewy body dementia, dementia related to Parkinson's disease, and more rare forms of dementia available as well. But the Alzheimer's dementia is definitely the most common.
So here's another question from the audience. Is it better to stay in your home or to move to an assisted living facility?
That is a great question as well, and not going to be a single answer for anyone. Certainly, that's going to depend on someone's resources and support in their community. And so I've had several older adults who have aged well in place, either by having additional support from family or friends, or bringing in outside home health agencies to bring in supports if and when they need it. There are several continuing retirement communities in the neighborhood or area as well that offer different levels of support for patients who can live independently, and then assisted living or nursing home if that gets to be the case. The biggest indication to me that a patient is no longer able to stay at home is when safety becomes a concern. So if someone's having repeat falls or having problems taking their medications, or safety concerns with cooking and leaving the stove on and things like that, that's usually an indication that someone either needs to bring more help into the home and supervision, or should be at a higher level of care.
Right, that makes sense. So we have a couple more questions from the audience. Here's one. When we hear about drug and alcohol issues, it's often focused on younger people, but older people have unique problems with alcohol, drugs, and the different kinds of medications that they might be taking. What specifically should older people consider about using alcohol and medications?
I think the first thing is to make sure you're talking to your doctor open and honestly about what you're using and how much. Several patients may have been drinking alcohol for many years, and their body may no longer handle it the same way when they were younger. And so it's important to note that what may have been appropriate for someone in their 40s or 50s, in their 70s or 80s, could be seen as more of a risky behavior and more health risk. That's true with medications as well. So that's why I think it's really important to reevaluate medications and look at, is this still needed as I've been getting older, or is this having problematic effects on my health? And you kind of have to reevaluate that as people change, because age is not just the number, it's the function too. So I've had some very young 80-year-olds that are doing just fine, but it really just depends on their function and their health status. And I would say that's true of any drug or medication that you really need to reevaluate, especially as we get older. So just like someone who has been drinking a certain amount of alcohol for their life, and maybe it wasn't a problem before, medications could become a problem as we get older too. There are patients that are going to be more prone to having low blood pressure or low blood sugars as they get older. And we certainly know that low blood pressures and low sugars are dangerous to older adults. So sometimes they may need a reduction in their medications, or these medications could be stopped completely.
So what kind of infrastructure do we need in our communities to make them more age-friendly?
That's a really great question, and something that is not going to be a single component. First of all, we just need our community to be open to hearing from older adults and hearing what their needs and wants for the community are. Affordable and safe housing for older adults, access to medical care, food, and their support, as well as transportation. And so all of these kind of look at multiple different components. And I really think at the heart of it is having involvement from older adults and hearing from them.
Right. Well, what other advice do you have for our audience as they seek to live their best lives as long as they possibly can?
Continue to look at your health as a holistic approach. Look at your body, your mind, your spirit, and do what you can to enhance those. Stay as active and involved in your community as you can, and that'll help keep you young and healthy.
Well, thank you so much, Dr. June, for joining us today and helping us understand this important issue.
It's been my pleasure, and thank you for having me.
Thank you so much for joining us today. And thank you to our sponsors, Kettering Health, Medical Resource Center, and Rodriguez Financial Services, LLC. Our sponsors make it possible to bring you this important and timely information. Please visit our website to learn so much more about these topics and others that will help you make the most of living in your prime.